Hi, everyone. Welcome to the University of Vermont Pediatric Residency Program. And welcome to Burlington, Vermont. We are located just up the hill there in the picture to the right of the clock tower. And this is the view from the outside, beautiful downtown Burlington. And welcome to our Children's Hospital, where our mascot is Monty. And this is the front of our Children's Hospital. And I'm Jill Reinhardt. I'm our Residency Program Director, and I'm accompanied today by...
I'm Christina Imming. I'm one of the pediatric hospitalists here and one of the APDs. And I'm Sarah Kauser. I'm one of the pediatric nephrologists and the second APD. We wanted to share a little bit about who we are with you guys today. We think it's really important for you to understand that we're a children's hospital within another hospital. And so there's lots of really wonderful and unique opportunities that come along with that. We try really hard to create individualized curriculums for our residents. And I think one of the great things about the program is that it feels like a family because it is a smaller program and people get to know each other really well, opening up the door for lots of different longitudinal learning opportunities with, really close mentorship, continuity with patients, families, etc. Despite it being a smaller program, we have a really strong academic environment here. There's so many people, that you'll say hi to in the hallways that are, nationally known and really well recognized. And we have a really important focus on advocacy as well. Being in a smaller state allows for us to advocate pretty comfortably, and it's a really unique opportunity that the residents get to participate in. We also have a diverse patient population here in Burlington and lots of opportunities for scholarship. One of the fun things that we've participated in over the last 10 years or so is our wellness and lifestyle system. Every block or rotation that the residents rotate through, we try to accomplish a list of wellness challenges and activities. And there are different houses. So as a resident, you would be sorted into various houses: Rhine Claw, Kaiserpuff, First and Door, and Slytherining, to compete for who has had the most, pictures taken, etc., of the different activities that we have. And it's a really fun way to get to know Vermont and get to know each other and sort of see what we're up to in our lives outside the hospital.
Yeah, and I think we really pride ourselves in being a team and working together. And as a small program, we really do rely on one another. And when I was a resident here many years ago, I guess I told my folks that it was kind of like summer camp, which maybe more like a boot camp, but the idea that this is a very unique experience that only the people that you go through it with really understand, maybe your partner, but definitely your other colleagues. And so we rely on each other to be there, and I have a strong belief in you, with this North Star being sort of what's best for the kids that we take care of.
On top of all the great training opportunities here, living in Vermont is also a beautiful place to live. So this photo, it looks like this here. It's great. And there's so many ways that you can enjoy your time here outside the hospital as well, since everything is so close together. And as well as our lifestyle here is overall a much more relaxed vibe, and people are more, willing to take in nature or their environment, and just have a more relaxed lifestyle than it is back. To kind of keep on that same theme, Vermont is known to be a state with overall high wellness and happy scores amongst the people who live here. and also is an extremely healthy place to live here and gets recognized for that as well. And finally, our children's hospital is also recently recognized by Money Magazine as being a top hospital for quality for children's services here, as well as the children's overall state of health in Vermont. It's considered to be a very healthy place to live for the other health metrics that goes into children's health. And finally, we also have a pretty robust opportunity here for different cultural events and sporting events. Even though we don't have a professional team, we do have many minor league teams. The Lake Monsters game is a baseball team. It's very fun. The stadium with great summer games and activities for families and kids. Our Vermont Green soccer team just recently won a national title, as did UVM soccer last year. So that has been quite the popular sporting event to follow. And then obviously we also have the other UVM sports teams that are great games to go and watch. We have great museums here, including the Shelburne Museum, which has lots of really cool exhibits that are kind of spread out throughout a very large campus. There's a music scene, tons of festivals, arts and breweries, and all kinds of other festivals for that. And then if you do want a major metropolitan city, Montreal is only about 90 minutes away, and that has everything you could also possibly want to experience. And then finally, we have wonderful seasons here. Obviously, New England is renowned for beautiful falls and summers, which are awesome. But then we also view winter as an opportunity up here in Vermont. We have a beautiful snow season with tons of snow-based recreation that really allow you to get outside and enjoy the winter rather than just be inside. So those sunny, snowy days, you'll find lots of people in Vermont outside doing all kinds of wonderful adventures. I personally love the winter here. I think a really unique part about where we are in Vermont is that we have a very large referral area and diverse patient population. From a demographic standpoint, we have a really broad catchment area. And so as a pediatric nephrologist and as residents, you will take care of children from all across the state of Vermont, as well as upstate New York. And we are it for children's hospitals. And so many families will travel hours to come see us. And so it allows you to see people from all different kinds of walks of life. And it's a really special part of being a physician here. In terms of pathology, we see really everything, even though it seems like, we're in a smaller state. Like I said, everything comes to us first. And so, we've seen things like botulism and, cystic fibrosis, literally everything, that you could imagine or not even imagine comes to us first. And because of that, we have a PICU that can upsize. We have a really strong NICU team, and then a variety of subspecialty services to make sure that the children in Vermont and New York get the best care.
And it may surprise you to learn that we have a very diverse patient population in Vermont. Within Chittenden County, which is where our hospital is, most children live in this more urban area. But within the whole state of Vermont, we have true rural poverty with patients who have limited access to transportation. We care for some of the Amish folks, as well as being an official refugee resettlement area for many different populations. Over the last 30 years, we have welcomed over 30,000 new Americans, and all families with children come through our pediatric clinic. So we see a variety of refugees and migrant families. So much so that we've developed a special integrated program for group well visits. That's on the bottom there. It's called Building Strong Families, and it's located within a parent family center in Burlington. Along with our diverse community, we have a very welcoming queer community here in Vermont. And part part of our commitment to this population is to staff what's called MedForce as part of a camp outright experience. So 1 or 2 residents each year will be part of the medical team at a camp that's designed specifically to have safe space for LGBTQ youth.
And within our children's hospital, we are part of the larger UVM hospital ourselves. So we're kind of a hospital within a hospital, but we consider it a hospital without walls. Most of our patients on the general pediatric service are on the 5th floor, and we take up a wing where all the specialists will admit their patients to that pediatrics floor. Our PICU is on the 3rd floor in spare space with the SICU, so that's nice that Dr. Clauser has mentioned we can flex the number of beds that we have based on the time of year and season. And then our nursery and NICU are both up on the 7th floor, so they're kind of spread out throughout the hospital where we care for our children. And then the outpatient centers are on their 4th floor, but really everywhere in the hospital is designed to have kind of kid-friendly spaces. We also get along very well with our community providers, and we're very tight with them. There's a great collaborative relationships that you'll learn when you come here and when you build it. So truly, there's no kind of like outside pediatricians. We are really all one team here in this rather small pediatrics community. And when we think about our hospital, we think that we really have everything that would allow a kid to have as I don't know, as good of a hospital stay as possible. So kind of all those wonderful child life services, music therapy, therapy dogs, like all of the great things that both inpatient and in the children's specialty centers to kind of help kids be happy. Our inpatient pediatric unit that I was just mentioning for Gen Peds, obviously I spent a lot of time there as not a hospitalist, but that's on our 5th floor. We do family-centered rounds there. So for all of the pediatric patients, you'll be rounding in the room and presenting to the families after kind of making a game plan outside the room. And we really try to focus as a hospital service and a pediatrics training program on helping you with your autonomy as a provider and thinking through cases on your own. Obviously working well within a team, but allowing you a chance to kind of really get a stab at doing that independent work, coming up with an assessment plan. And also even at nighttime, having some independent time to kind of make your own management decisions. We also focus on longitudinal learning here. And, you know, like we were just seeing, you know, all of the subspecialists will also, you know, admit to the same floor. So when you're, you know, taking care of patients on the floor, you will take care of hospital patients, but also, you know, you'll have oncology patients on your list, you'll have nephrology patients, neurology, pulmonology, and because of that, every time you rotate on the floor, you're having exposure to all of those types of patients again. And so you get really wonderful continuity over the 3 years that you're a resident here. I was a resident here a few years ago, and, you know, some of my best, you know, relationships with patients were from the floor, patients that had cancer or other chronic diseases that I met as an intern and continued to care for as a 3rd-year resident. And so you really get to see how things change and progress over time. And it's just a really unique thing that's different from other residency training programs.
Yes, I would say sets us up pretty well for meeting the new ACPME guidelines as well, which, as you probably have heard, are reducing the inpatient training overall. And because we have one ward team, our program really hasn't been affected much by that limitation, since we have a lot of outpatient work when we were on the subspecialty electives.
Another service that you'll be on besides your Gen Pediatric service is your newborn nursery, which you'll do during your intern year. And it tends to be a really popular time for interns kind of coming in those early months to kind of get some great new little babies as their patients. So you'll go in and meet these new parents who may or may not have a practice picked out yet. A lot of times they don't. They're just going to go to UPED. And so, you know, residents love to kind of grab them and put them on their schedule and start following those kids as they grow from babies to toddlers. It's a really wonderful experience that way. We also have a pretty, I would say we see a lot of diversity in our nursery population, even perhaps more so than the general services, because, you know, a lot of people have babies. So that's a really great time for the residents who are interested in that new American population to kind of try to get a relationship with some of those families and get them onto their channels as well. There's also a lot pacing curriculum, and people kind of do extra work in that field as well. You'll be working one-on-one with the newborn hospitalist. There's one intern on this team, and then the hospitalist, and you'll have some students usually as well. So you get a lot of great teaching that way. And we definitely try to give you your chance to sort of be as independent as you can when you're doing your nursery care. And then there is an option to pursue if you were trying to get teaching in for non-research circumstances to seek out some opportunities with those as well. And then in terms of our ICU level care, we have a 29-bed NICU, and then there's also a transition unit. And they do a wonderful job caring for the babies in this region. Residents have their team, and then there's also an APP team. And they do go to deliveries and learn some of that stabilization as well. And then now there's also a checklist where you can develop your skills to go, independently and kind of be signed off in your delivery resuscitation skills, which is also plays in nicely kind of to the new focus on that element of care for residency goals, to be competent in DR for those people who are going to be practicing in the community. We also have that 4 to 8 bed PICU, like I was saying, that can flex based on kind of seasonality, and sometimes we go above 8, like during the RSV surge for Bay Fortis, and sometimes during the winter, we have gone up above that as well, because we don't close and we don't leave kids in the community hospitals. We were usually able to figure out something by moving adults. And there's also opportunity for involvement in some of the transport QI work that goes on, some procedural stuff, and then obviously teamwork when it comes to caring for these sick kids. In terms of our ER training, we are a level 1 trauma center with only one around for kids. And we also have pediatric EM faculty who staff days and evenings. And then you'll be spending time rotating with them, which is great. And you'll learn some of the procedure things down there and just, their wonderful EM trained knowledge. And then the true overnight hours, the grave shift hours, it tends to be adult providers, which is a really wonderful opportunity for our senior residents. They usually get consults to go down for most pediatric patients. And so they'll see those consults independently in the ER, provide recommendations for the ER. And then they have the opportunity to admit them independently if they feel comfortable and kind of take over that pediatric management and really hone those independent skills of being a pediatric physician. Our Children's Specialty Center is also located here, on campus, and we offer over 20 different specialties for the patients in Vermont, but also for you as learners. So when you come to spend time in any of your subspecialty rotations, you'll spend time here in the subspecialty center. And because all of the, practices are sort of in the same space, that allows for a lot of collaboration between the specialties, and you get to, see a lot of different areas where there's multidisciplinary clinics. So you can, say you're doing your pulmonary rotation and you go to CF clinic and you get to, hang out with one patient and you'll see the pulmonologist and, how they interact with the patient. You'll see the gastroenterologist, the dietitian, the respiratory therapist. You really get to see how care works for these really complicated children, and the importance of, all different providers as well as, ancillary team members. So I think there's really a lot of learning opportunities there. Another great opportunity for residents is our simulation training and mock codes. We do these sort of, mock codes once a month, and the residents really enjoy getting, sort of hands-on experience with, doing procedures and just thinking about different case scenarios. So it gives you a lot of, opportunities to practice your skills in a safe setting.
And then in terms of connection with the community and community-based training, we have lots of opportunities for that. The residents are part of weekly half-day continuity clinics, as well as having 3 blocks of primary care. So in your first year, you'll spend a block in primary care here at our university practice. In your second year, you'll be able to choose a community practice to spend a block with. And then in your third year, we have a required underserved population rotation. And recently we have developed a rural concentration for those who are interested in either primary care in rural areas or rural hospitalist rotations that provide some additional training to help support your role in a rural community. We also have opportunities for global health. And as I mentioned previously, working with our Building Strong Families allows for sort of local global health learning. Our Building Strong Families Clinic has been a huge success with group well visits. So, for example, families will bring in all their 9-month-olds. They'll have time together as a group to ask questions and to receive some anticipatory guidance around 9-month-olds, and then have individualized time with the physicians as well. In terms of community advocacy, we also have school-based health clinics, and actually our second school-based health clinic at Winooski Elementary School, which is right down the hill from the hospital, was founded by one of our pediatric residents about 5 years ago, and is now a regular part of our university practice, which helps enhance the relationship with their medical home, but allow kids to stay in school frequently.
From a education standpoint, we really have the ability to think about you as a learner and how we can best accommodate your needs. I think the overall focus is really to develop really strong and outstanding physicians in general pediatrics at the point of your pediatric residency, right? But we also want to be mindful of what you're interested in, and so as you progress through your residency, you'll have more and more opportunities to pursue different electives, to try to make this what you want. So if you're going into nephrology like I did, you get to spend more time potentially with a nephrologist. Or if you're going into hospitalist medicine, maybe there's more opportunities for you to spend a little bit of time in the delivery room and having more experiences there. So we really try to tailor the schedule or your schedule to what your needs are, knowing that you'll be a wonderful pediatrician, and then hopefully have at least some specialized curriculum on top of that. Specifically, we have about 2 elective blocks for your intern year, and then that increases significantly over your second and third year. So you'll have 5 elective blocks during your second year, and then half of your schedule as a third year is elective time. And so you can, this list is not inclusive, just some of the things that residents pursue. When I was a third year interested in nephrology, I spent some time with a pathologist looking at, renal tissue, just to try to, again, tailor my curriculum a little bit more. So there's a whole world of options, and we try to be supportive of all of that.
We have been sort of ahead of the game in terms of integrating our mental and behavioral health curriculum, having a work group that's worked on this for about 6 years now. And so it is anchored by 1 month experience in your first year. When you are introduced to our child and adolescent psychology consult service, you will be involved in autism assessments, as well as straightforward sort of parenting and behavioral medicine. We are working towards creating a mental behavioral health continuity clinic model that is staffed by residents and attended by psychiatry and pediatrics together. We have integrated didactics throughout your didactics and academic half day, and we work closely between developmental behavioral piece and mental health and behavioral piece to make sure that those are complementary experiences and provided with the tools that you'll need. And we've all needed more and more as mental health has become such a huge issue with our population. Child development, we are lucky to have a child and behavioral development pediatrician who is really focusing on early childhood development concerns with both autism assessments and other learning needs. and introduces you to all of the places that help support children early on in their development that are available in the community. Our adolescent month is also in your first year. You spend one-on-one with an adolescent specialist. We'll spend time going to the school-based clinics, participate in our transgender youth program, meet a group of advocates that are adolescents, known as the Vermont Rays, which is a pretty interesting and unique experience of having youth who are involved with the Children's Hospital available for any quality improvement projects that we might have ideas for, or to get feedback. And when we were trying to dissuade vaping, we brought a list of questions to this group, and we're able to hone our advocacy really based on what our students were telling us. And lots of opportunities for community outreach as well. Our global health curriculum, we are supported with an affiliate program with the medical school that enables us to support a resident every year on a global health experience. We typically save that for third years, and also have opportunities for rotations with those faculty who have different international projects. Our NICU has an incredibly robust international program. One of those programs is called Helping Babies Breathe, and it's actually international. And our faculty, along with residents, will travel internationally to help teach programs that have been taught by the trainer in those areas across the world to sustain that curriculum. As you probably can tell, advocacy is really near and dear to our hearts here in Vermont. Again, we have a advocacy curriculum that's sort of grounded in a 2-block session in your first year, where you will meet our AAP chapter, our Vermont Child Health Improvement Program, which helps support quality improvement efforts throughout pediatrics in our state. And then we have 2 additional weeks in your second year to plan for hoping to support longitudinal advocacy projects. When you arrive here, you will partake in something called the Intercultural Development Inventory, which sort of assesses where your comfort level is along that cultural humility pathway, both in how you feel comfortable with problem solving, but in addressing even differences between your culture and another person, and then support a development plan around that. And then annually, we have a Northern New England Advocacy Conference, which is between the AAP chapters of Vermont, New Hampshire, and Maine, as well as our residency program. And we come together each fall for in-person conference where our residents will highlight some of the projects they're involved with, as well as having some national leaders come and share their expertise with us. Some of the things that we've been able to advocate for here with our residents in the last several years have been to promote gun safety legislation. We used to have a D+ rating for gun safety, and now we're up to B+. So we have made some huge changes in a short amount of time under the AAP leadership. We were able to get this philosophical exemption removed for vaccines, to pass Tobacco 21 legislation, as well as advocate for a college of medicine scholarship to help support physicians who come back to come back to practice in Vermont in a rural location.
One of the newer aspects of our curriculum that was actually brought by feedback from our residents that we incorporated with Sister Academic Half Days. And this is for all residents who are not on nights, and they have 2 half days per month where they do a large group setting learning. It allows them to all be together, and also to kind of be more protected for their learning time rather than doing some of the lectures while they're on service. The inpatient teams have coverage kind of arranged ahead of time for them. The sessions are both traditional didactics and taught by faculty with, a curriculum that kind of has an overview in mind to kind of go through all of the essential elements of pediatrics, but then also there is a lot of chances for simulation or interactive learning, case-based sessions, and just things that you can kind of do when you have more of a group setting with some projected time. So we've really tried to make that a more valuable learning opportunity for in the last couple of years. Some of our quality improvement work that we also have been doing that our residents were always part of and valued has been over the last couple of years, changing the way our NICU night structure works, changing the way the professor rounds work as well, and then using more of the academic half-day style. The Mind Body Buddy program with our psychiatry program. And they also have been involved in some of the safety projects on the floor in terms of anticoagulation, the sort of inpatient protocol, NAT screenings, food insecurity, as well as food pantry, bronchiolitis in terms of changing the way that the babies are reducing over monitoring. And they were also involved in our Project Light Hyperbility project recently. So just lots of opportunities abound for being involved in the QI and safety measures that are taking place here.
And through, in terms of true research, we also have a vice chair of research who is involved with overall research of our department, but also with promoting clinical research with our residents, as well as having case conferences and M&M conferences to look at improving the care for the children that we take care of, with the goal overall to support a scholarly work at a conference for each of our residents. And to help support that, we have in the last year a new innovation started by last year's chief resident called a scholarly half day. So that on electives, we will have 2 projected half days to dedicate to your longitudinal project. So you're able to sort of set standing meetings, but know that you'll have some protected time within your other structural activities to do so. You eventually choose a mentoring pod in the areas of rural medicine, QI, DEI, global health, med ed, or advocacy. And then we have dedicated resources and faculty mentorship to each of those pod meetings with, again, that goal to be able to share scholarly work on some projects and the residency poster or a workshop or a conference presentation. And here's some examples of recent work that our residents have been involved with. Each August, we have a opportunity fair where faculty can come and present different projects that they're involved with and help encourage and recruit residents to participate along with them. That's been a very successful way of keeping the research and scholarly activity going.
Because of the smaller nature of our program, we have a lot of one-on-one mentorship and teaching. Right from the get-go, you'll be paired with a mentor, and you'll get to know them, and they'll help you throughout your time in residency. There's also a lot of one-on-one teaching with faculty. We only have fellows in our NICU here, and so when you're learning on the floor or in clinic, you're working directly with a faculty member, and so there's lots of opportunities for learning and mentorship within that sort of unique relationship. Residents also care for complex patients directly with our subspecialty faculty, sort of going off of what we just were, talking about a little bit before. And then, our faculty is super accessible. On your walk to, our resident library, you'll pass lots of different subspecialty offices, and most of the time our doors are always open, so you can hop in, ask a question really easily, or just, chat. We're always here.
Here we are.
Okay.
In terms of inclusivity and belonging, despite what's sort of happening at a national level, our chair has identified 2 vice chairs, myself and my colleague, Louise Zalaco. And we are focusing on making sure that our community is inclusive and help support pediatric projects for the annual Health Equity Summit that our UVM network sponsors. We also have mentoring programs between BIPOC and Latinx medical students, residents, and fellows with the aim of creating a community of support. We have a program called UP, which matches health sciences undergraduates with pediatricians to help promote pediatrics in populations that may not have been interested in them or had an opportunity to see what practicing medicine is all about. Our full-time faculty have been involved for many years now in sort of self-directed race-based discussions on certain topics like health disparities with people with intellectual disabilities. It's provided us with regular spaces to discuss these challenges and help make improvements to the care that we provide. And although we're small, we are quite academically rigorous, and I like to share all the national organizations that you'll find Vermont is a major leader in, including the Bright Futures, which is our sort of home for primary care. It's edited by 3 Vermonters. Our Pediatrics Journal has been edited for decades by Dr. Hertz, who is the current chair of pediatrics. And when our faculty aren't here in a way at these different meetings, they're thinking about you and the residents and opening doors for opportunities to attend conferences or to participate in additional curriculums, even focusing what you're interested in subspecialty learning.
Another very unique opportunity here is our focus on teaching and allowing you to really practice that role for yourself. You will get an appointment as a clinical instructor when you come here as a resident because of your sort of formalized pathway towards teaching students. During your inpatient time, you'll be, well, at one point you'll be like the clinical senior, and 2 other times you will be what we call the teaching resident, which your main job is, as usually as a 3rd-year resident, so you do support this current clinical senior, but you also have dedicated time where your primary job is to help the med students. So whether it's the things such as like preparing their presentations and going over notes, providing feedback, but also to arrange didactic sessions for them, do chalk talks, do farm to table, pharmacy to table, radiology rounds, all kinds of really cool things, simulations that really give you a chance to practice what your teaching skills would be for when you become an attending. We have an attending set aside that's kind of your backup person to help you to come up with some of those ideas while you're in that role. And then there's also just support from a med ed standpoint, leadership for you when you're in the teaching resident role. Additionally, we also have a teaching academy, which is something a lot of our faculty do, but you as a resident can also be involved in coming up with like a medical education project and working with their support to kind of see it through to fruition. And then there's lots of opportunities for conferences, seminars, special workshops that you can really hone your teaching skills and have some great CV and real life experience. So, throughout the residency, we also want to make sure that we focus on your wellness too. Years ago, there was, push from our resident team to switch from, 24-hour calls to 12-hour calls. So, throughout your residency, there won't be a time to have a 24-hour shift, which I think is really unique and special about our program. The residents, when they are on nights, do a night float system, which I think the residents feel like helps them adjust a little bit better to being on nights rather than, doing 24-hour calls. We also have a backup system. So if you were to, get sick or have a family emergency, there's someone there that can help support you and cover your shift or shifts. And then I think another important piece is that interns do night call on the Gen Peds patients only. And so you're not having to cover, nights in the NICU while you're an intern, especially, when you start off, the NICU can be a kind of intimidating environment. And so we try to protect our interns in that way. Residents really make their own, schedules themselves. And so you can trade calls with each other to make things more specialized for your, life and what things look like at home for you. And then we work in the administrative half days and we make sure to, provide psychology support if needed. We also have retreat days for each class over the course of a year. These are just some pictures of different retreats over time. But for instance, our interns did a teamwork and adult learning retreat. Our second years did a leadership and professional development retreat, and then our third years did a looking forward retreat. So a lot of the morning is focused on education and your specific year and what you might be working on and thinking about as a first or second or third year resident. And then the afternoon is really time for your class to go have some bonding time, whether that's, doing an escape room or going kayaking, going to the farmer's market, those sorts of things, just so you guys get time together as a class. And ultimately, our residents are really well trained and prepared to go anywhere. The residents over the last, 10 years have gone to, fellowship programs all across the country. You can see some of these programs here, but they really go everywhere into really, nationally known programs. And so we really, like we talked about before, we have a lot of national connections, even though we're small. And so we try to support you in that way. And then there's also just a lot of wonderful, primary care hospitalists, positions that our residents go to. You can see that there's certainly a focus in New England, but that hasn't limited people from going to California or Montana, wherever they want to go.
Yeah, and hopefully that's given you a little bit of background on our program at the University of Vermont. We look forward to seeing you and sharing more with you about our program. Thanks, everybody.
Thank you.